What's up, guys? Welcome back to the channel. My name is Phil Sarpon. This is Phil's Guide to PsyD. This channel is dedicated to all things clinical psychology. If you are interested in clinical psychology, if you are applying to a clinical psychology program, or if you are already in a clinical psychology program, this channel is dedicated towards you. So today's topic, we're going to be talking about clinical psychology. And the question is, what is clinical psychology? Now, the reason I wanted to talk about this, guys, is because you would be surprised with how many people do not know what clinical psychologists do. And so I just want to give you guys a quick video and overview of what clinical psychology is so you can tell your family members and your friends when they ask you. So there's three things that clinical psychologists can do. Number one is therapy. Clinical psychologists are trained to give evidence-based therapy. That includes DBT, CBT, existential, psychodynamic, whatever evidence-based therapy is out there, they are trained to do that. One thing that you'll note with clinical psychologists is that because of their training, they're more equipped to handle severe mental illness. The second thing is that it kind of leads into this, is that they can diagnose patients and clients, right? They can do assessment and interventions to help figure out what clients are specifically going through, right? And so if there's a child that comes in that has symptoms of ADHD, they can do these assessments to figure out where they fall in line with that and actually diagnose them with ADHD based on the symptoms, based on the assessments, based on the measures that they give them. The third thing is not necessarily universal or not necessarily a mandated thing throughout the whole of the United States. It really does depend on the state that you abide in. But some states do allow psychologists to prescribe medication, okay? Now, again, this is not for every state, this is not worldwide, but psychologists, after they become licensed, can get extra training and extra certifications on the possibility of them prescribing medication for their clients. So as you can see, a clinical psychologist can function very similarly to a psychiatrist, right? Because psychiatrists can do therapy, they can do interventions and assessment, and they can also prescribe medication. But of course, the medication part is always going to be limited for a clinical psychologist. What would the reason to go to a clinical psychologist over a psychiatrist or over a counselor could be? One example could be going to a clinical psychologist might give you the opportunity first to try different types of therapy. And if the therapy doesn't work, a psychologist can actually do assessment with the client to figure out if they are going through a particular mental health illness. But the whole point is first to try the different therapies. If the therapy doesn't work, to assess and diagnose them. And then once you do get the diagnosis, to figure out if they might need medication by referring out to another professional like a psychiatrist, or if you are trained in your state to prescribe medication, seeing if you could actually prescribe the medication to them and if that would help. That's basically what a clinical psychologist does. Those are the three main things. They can work in all different types of facilities. I'm sure in future videos I'll do comparisons between counselors and social workers with clinical psychologists and even psychiatrists, because the whole mental health area is filled with a lot of mental health professionals that do different things, but we also all need each other. Each professional is important in their own way. So if you guys like this video, definitely give it a thumbs up, subscribe to the channel, and hopefully I will see you guys in the next video.